And everything that we experience today is scarred, fibrotic regeneration. And that's how we end up parts of our bodies that don't work after long periods of time. If we could have been hitting them with exosomes since we were 30, everything would be limber. Everything would be strong. And that's
Yeah, like utopia right there.
it's utopia, right? Just think of anybody who has a very bad scar. It didn't need to scar.
I'm Todd Vande Hei, CEO of Stark, and I've gone from vegan to paleo to keto to carnivore, from cryosaunas to ice baths, to training like an athlete to being injured like one, enhancing my mobility and optimizing my sex hormones. With thousands of labs and thousands of scans, I'm surrounded by high-level medical doctors, naturopathic doctors, chiropractors, nutritionists, and strength coaches, all leading me in concert to a state of optimal health. And I'm here to share those solutions with you regardless of your age, your genes, or your medical conditions. Today, I'm really excited because I'm joined by Dr. Duncan Ross, the founder of Chimera Labs and one of the pioneers in the field of exosome research and development. We're going to unpack what exosomes are, how they work, and why they're generating so much excitement in my world and in the world of regenerative medicine and longevity. So let's start with something simple. Actually, this is not very simple. What are exosomes and how do they function in the human body?
For exosomes, well, I've started saying now parts of stem cells, and I did that because of some laws that have come onto the books in the state of Florida, saying that stem cells are legal. And when you think about it, what an exosome really is a bilipid membrane um, piece that has been broken out of a cell. And it just wasn't randomly broken out, it was secreted by the cell, and it packages different blueprint products, be it microRNA, messenger RNA, or proteins. But it was definitely on a trajectory to be released by the cell, whereas it was thought to be trash 20 years ago. And the therapeutic uses of it didn't become obvious until much, much later, probably around 2012, 2013. And I developed our first exosome in 2014.
When you say develop, what do you mean by that?
Exosomes were known in the research world, and they were isolated by ultracentrifugation. That does not lend itself well to creating a product that you can use in a human. That's something that you could just look at in the laboratory. So, coming up with an isolation method that didn't touch the exosome, such that when I get it out, I can put it into you without having any adverse events, was something novel to what we did, and we've been going since that way ever since. And now, people, pharma does do it that way, but you could not have found the method that we use in a journal in 2014. It just didn't exist. And that safety record is really what the big deal about Chimera is. I mean, even when people do things that I wouldn't have suggested, such as injecting the exosomes intrathecally, these were doctors that I work with that wanted to do.
Did you
these
say
things.
intrathecally?
Intrathecally, yes. That's kind of where we got our
Like
into the
like fecal
central
matter?
No, intrathecally, and I don't have a lisp.
Gotcha.
So directly into the central. Directly into the central
I
nervous.
actually thought you said that.
But
right.
Actually, I'm glad you brought that up, because let's go back to intrathecally, because
All right.
it's a fantastic method of inserting the exosomes. And using an enema not only gave me my first child from treating a patient with IBS. She got pregnant. We also suppressed her IBS because it's a great place to take it up. And if you're looking at colorectal inflammation, that's really a way to go. And the delivery mechanisms of Chimera, of exosomes, is what we try to share in our roundtables and different ways, because there's things that you just wouldn't think of. You wouldn't think that for IBS you would inject intraperitoneally. You wouldn't think that. I mean, certainly you should have confidence in the exosome before you inject it into somebody's central nervous system. And I mean, that was something that I couldn't stop doctors from doing back in 2015, but it did terrify me. But the reason you know about Chimera today is because we've never had a contaminated product and we've never had an adverse event. If that had happened back then, you may never have heard of me to begin with. So that was it. So the modes and methods of administration, a nasal spray may be good for ALS. That's what people are doing in Antigua. We are working heavily using focused ultrasound to try to get exosomes to target parts of the brain, but they will,
Oh, like stroke victims.
like stroke victims, for instance. If you have a stroke victim who is within 24 to 48 hours, they have enough inflammation going on in their brain that the exosomes will go there. But what if they come to you 6 months or 2 years later? You have to do something to make that exosome traffic. So you would take an MRI, you would see where these lesions are, and then you would focus the ultrasound on that, and the exosomes would preferentially go out there.
Like mosquitoes to a light, sort of?
Exactly like that.
They just cluster right around the area?
Well, so that was the theory, right? But we had to prove it. And then that's where our 2023 Nature paper came from, is we set up a rat model at the City of Hope here in LA. And we've demonstrated that 100 times more exosomes go where we focus the ultrasound than where we didn't in the same
Huh.
brain of a rat.
That's
So
fascinating.
that's probably the biggest publication that Chimera has done, and certainly since I left grad school, because I'm not just telling you now that the exosomes are in the vial. I can track them to the brain of a rat and demonstrate that 100 times more go when we have some kind of intervention. And I'm very proud of that, because one of the issues with exosomes, and I saw you were interested in this, is, what makes us different, or what's difficult about it is the problem is that you cannot see an exosome. So when a rep comes in and gives you a vial, it just looks like sailing to you. And what has happened in the industry is, people just run around saying whatever they want. There's no way to really catch them unless you have a lab like mine. And certainly most manufacturers aren't interested in doing all the methods of characterization that we do. It's, in some regards, for aesthetics, it's probably a waste of money to do what we do. But everything that we do is based on trying to get FDA approval. And so we do all these methods of characterization that we would do for the drug, which is coming. And I was actually just on an industry panel this morning at 9 o'clock in the morning that had the other pharmaceutical industry exosome companies on it. And none of them are doing all this characterization, and they're not past phase 1, 2 studies. So,
and you mentioned a drug. You're working on a drug built of exosomes, or can you kind of explain if you can you explain further what that means?
So to market for, say, inflammatory bowel disease, I need to have an approved biologics license from the FDA. And so in that case, and because I'm marketing it for that indication, it is absolutely a drug, and I must get through phase 3 studies. When we talk about our topical applications for cosmetics or hair, that's not a drug. That's a cosmetic. And so, it's marketed in a different way. It's actually a different product, slightly. And that's how we look at it. So,
you mentioned hair. Just gonna make a note of that. Can you talk a little bit more about that? Is this like a hair restoration concept? And are you talking about injections into the scalp, or is it a topical application, or what does that look like?
I'm really kind of astounded sometimes by what our Chiara product could do, which is the secretome. So it's the exosomes in the growth factor soup. And you can just microneedle that along somebody's head, and within 4 to 5 sessions, if not less, you're going to see androgenic alopecia. You're going to see growth for sure. I mean, I can almost guarantee you. Now, if the patient comes in with alopecia areata, which is just an autoimmune disease causing you to lose your hair, much like lots of people lost their hair in COVID, that's even easier. One treatment, and that hair is going to grow back. They really don't need much to tip it past autoimmune to tolerate. And I've seen a practitioner of ours use one vial, and 80% of the hair grows back.
Wow. Yeah. My hair started jumping ship during COVID, and it's never been the same. I know I have some, but
Uh-huh.
it was previously it was glorious. It was one of my my favorite features, and now you can kind of look straight through to my forehead, and I'm just kind of
Well,
shrugging my
but see,
shoulders.
you're the perfect
Uh-huh.
candidate. So,
That's funny. So you used the word soup. I've heard you use this term a few different times now. What does that mean exactly?
when you grow cells in a culture, they make a soup. They secrete exosomes, but they secrete other things too, and those are all in different amounts. That makes things very squirrely when you're trying to characterize it, say for the FDA, because these things all change. So what we're trying to do is have something that's completely reproducible. So it's the exosome, and that exosome I can isolate all the other stuff that's in the culture medium. You might not want some of the stuff that's in this culture medium. Some of it is actually urine, basically, if you want to think about it that way. Some of it is calcium that you might not want. I mean, there's all kinds of variables that you as a practitioner do not want to get into. So when I provide you with the exosome that's hyper characterized and hyper isolated, you know how much RNA you know how much protein you have, and then when you do it from patient to patient to patient, you know exactly what you're doing. If a soup does not give you that same level of precision, sometimes you're going to have more benefits, and sometimes you're going to have less, and that's why we go through that trouble. It is easier to make a soup. That's because I don't have to isolate. That's why it's cheaper.
But it's better in certain applications, right? Is that what you're saying? Like facials
It's
or
more
scalp?
cost effective, right?
Oh, I thought it was more
It's more cost
effective
effective.
itself.
I wouldn't call it more effective.
Okay,
I would call it more cost effective. Um, because when we give you the Luxear and the Luxear Plus products, those are concentrated exosomes. And so you're wielding an arrow versus a sledgehammer. So,
and you think that is that more? I think Alice used some of those, the Luxor Plus exosomes, which has something like 14 trillion extracellular vesicles or
trillion,
something.
15, right?
15.
Yep.
Okay. Also, she gave me an IV, but she also used it on my scalp. Is that more effective, or is it just more expensive?
There's more exosomes in a vial of Luxear Plus
Okay.
than in a vial of Kiara.
Okay.
Yeah.
Okay.
And when you think about it from my point of view, from regulatory, I cannot have lots that are off by more than 10%,
Sure.
5 to 10%. If I was doing the soup, it would be 20%, 25%.
Got it.
So,
Okay.
yeah.
Okay.
So if you're trying to build protocols, you do that with Luxear.
Okay.
If you're trying to bring somebody in for med spa type things, then Kiara is
Okay.
sufficient.
There's a lot of consumer confusion. I want to come back to the topic of, or define terms a little bit more clearly. Just kind of hit it from a different angle. It's where when I have conversations with consumers, they get the most that look on their blank look on their face, look of confusion. Almost everyone seems to have some understanding of what a stem cell is. Exosomes leads to that confused stare back. Can you maybe describe how they work together, why they're confused, and just help clarify what that means for the audience?
So whether it was a stem cell or an exosome, you really wouldn't care if you're looking at the outcome. So let's say you have an in vitro outcome like me, a wound healing assay, or in your case, a hair that you want to grow back. X number of stem cells and X number of exosomes are going to achieve the same thing. In that case, the way I decided how many exosomes are going to be in a vial of Luxear Plus and Luxear was based on the efficacy I saw from that many stem cells when I was using stem cells, because that's what I used at first in 2012. So I wasn't going to go backwards and just guess the amount of exosomes. I created vials that were exactly the amount of exosomes that, say, the X million of stem cells would secrete. So you could really, with confidence, say to a patient, I'm going to give you this many stem cells. I mean, you're really giving them exosomes, but you're getting the same potency as those, right? Um, and the exosomes do provide some benefit, and then that's why I got excited about them. First of all, it's hard to keep stem cells sterile and not contaminated. Once you're growing stem cells and they get contaminated, there's nothing you can do because you can't separate the bacteria. So, in err on the side of caution and safety, exosomes go through filters that don't allow bacteria through. So there's no way to get a contaminated exosome. That's one. Second of all, because they're not alive, I don't have to worry about cryopreserving them in liquid nitrogen or delivering them to you that way. You can keep these in your regular freezer or -80 freezer for years, and they're still going to have the same efficacy. Then, when we get to things like interstitial cystitis or stroke or all these things, they're small enough that they can cross these lumens and the blood-brain barrier, which cells could not do. So it provides a completely different usage paradigm. Whereas, like, say, COPD, well, you give somebody cells by IV for COPD, they're going to get stuck in the lung, and you have these great outcomes for COPD. Well, maybe you would want to nebulize exosomes instead, which you couldn't do with cells. Injecting cells as a nasal spray is not going to get against across the cribriform plate. So there's all these cool usages. But then again, I never just completely say you don't want cells. I mean, what if you're working on osteoarthritis in somebody's knee? Their cells from their fat or their bone marrow are fantastic. They even provide some cushioning. And then you add exosomes to that, and now you're really creating a nice milieu in this cell. So it's kind of up to the practitioner to decide when and where they're going to deploy things. Cells are also more expensive. Being able to use X amount of cells to make many lots of exosomes makes me bring the price point down. So, if you were to think about somebody who gets a CAR T therapy or something, that's 100,000 to $1 million therapy, and I'm selling these vials for much, much less, right? I couldn't do that if I was selling characterized cells. So, like, the cells that we use for these exosomes are fully characterized and approved by the FDA to make exosomes for clinical trials. If I were to be giving you those cells, how quickly would I run out of them, et cetera? So it just really allows me to apply a safety profile.
Such fascinating stuff. Can you kind of walk us through what actually happens inside the body when someone receives an exosome infusion? Like, do they just move wherever they desire, or?
So that was a big question. So to that point, people have liked to say that they're dumb missiles. Well, they're not. So like I just said, if you put cells in IV, they're going to go to the lung. If you put them in sub-Q, they're going to stay there for a long time. The cool part about the exosomes, and this was in the literature before I had to do these experiments, is they would go to the spleen and they would go to the liver. So now you got it to the biggest immunological patch in the body. So if you're trying to treat osteoarthritis, autoimmune disease, RA, these type of things, you want to be shooting for the spleen or the lymph nodes. Now, interestingly, if you have, say, an induced kidney disease or something like that, once the cells get to the spleen, they get taken up by macrophages, then they'll traffic out to where that inflammation is. And we've seen very cool things where if you have a wound, really bad wound, and you were trying to treat a kidney, the exosomes would end up going to the womb, the wound, and not the kidney because of all the inflammation in the wound. And the
Is that
wound
the
would
signal? The
resolve very
inflammation
quick.
is the signal. It's
That inflammation is the signal that attracts monocytes, macrophages, mesenchymal stem cells, and so it goes there. And that's why when we ask you to do hair or a face, that you're causing this inflammation first, either through
okay.
microneedling or Morpheus or something like that. That stuff is very necessary before you give the exosome.
Oh, that makes total sense. You're creating the inflammation, and it's the signal to the exosomes to go there to begin the healing process. Makes a lot of sense. Let's talk about the safety profile of exosomes. That's something that comes up a lot in conversation. People being concerned about things like, I don't know, cancer or some other severe outcome. Walk through what we know about that today.
Um, Cancer. Well, what we know about that today is, first of all, when people look up exosomes, they immediately find cancer because cancer, one of the ways that, and that scares them off of exosomes. The reason that cancer does that is it is secreting very large exosomes, 400 to 500 or larger nanometers, that actually have DNA in them. And then those are going to different parts of the body and causing metastasis. It's very interesting, very scary. But when you're making exosomes, as I am, from mesenchymal stem cells, they are not making those type of exosomes. They're making these anti-inflammatory therapeutic exosomes. Plants make exosomes too. You're not going to be too worried that a plant exosome is going to give you cancer. And so that's one of the things that people see. Now, there are exosome therapeutics coming for some things like pancreatic cancers, colon cancers. And what that has to do with is suppressing mistimed or misguided cells, making them act normal by providing them with normal exosomes. So you can think of it like a fix-a-flat. A colon cancer cell might be deficient in 12 or 15 microRNA, and the exosome you put in might replace those, and the cell starts acting normally. So that's how you would come up with a cancer therapeutic for that. But if anything, the normal MSC exosomes that are coming out of the cell right now would be anti-tumorigenic, not pro-tumorigenic in a patient.
Super exciting. So as you're looking into the future, these can be things that are not proven, that you don't believe you're certain about yet. What do you think are the most exciting possibilities for the various forms of exosome therapies?
When you think about how often people are using NSAIDs for whatever purpose, I mean, you know that that's a temporary fix, and these are small inflammations. Now, if somebody has a really debilitating autoimmune disease, that's where these rituximabs, Humiras, those are not going to go away. You need something that strong to stop that kind of an inflammation. But on these smaller ones, on inflammation post wound or post orthopedic stress, or say a football player who just strained a tendon, what are you going to do for that? You don't need Humira for that, but you do need to stop the inflammation in a robust way, such that you get normal regeneration. And everything that we experience today is scarred, fibrotic regeneration. And that's how we end up parts of our bodies that don't work after long periods of time. If we could have been hitting them with exosomes since we were 30, everything would be limber. Everything would be strong. And
Yeah,
that's
like utopia right there.
it's utopia, right? Just think of anybody who has a very bad scar. It didn't need to scar.
If you imagine that I want to get back to my 25-year-old self and I move like, I think a better analogy would be like a South Park character. Have you ever watched South Park?
Yeah,
No,
actually.
they kind of like shuffle around. That's how I move. I would love to move like my younger self. You think that's possible in the future?
Absolutely. I think that, with a lot of these things, you have to re-injure it. So if you had a scar, we would need to microneedle and get that scar to start reforming, and then to get it to form normally. So this is where your stretching comes in. This is where shockwave devices come in, and that's why I do love those for anything that we're doing. Like, let's say you had OA in the knee. By using that shockwave around the knee early, you're going to cause stem cells to traffic to that area before you actually go and do whatever you're going to do to the knee. And I see that as super beneficial. There's another one called a piezo wave that I really like. It's a focused ultrasound.
These are coupled with exosome IVs or exosome injections?
Well, exosomes, however you're going to use them. I don't. I mean, honestly, you could be swallowing them. That's whenever I had a vial that thawed for some reason, I'll hold it underneath my
Really?
tongue. Yeah, people
don't
make a
want to
joke.
don't
I
want to
bet you
toss it.
I bet you drink exosomes. As a matter of fact, I
That's
do.
funny.
I'm not.
That's really funny.
I'm not letting those things go to waste.
We have shockwave devices here, so maybe we'll consider combining those therapies. That's sort of what you're suggesting.
That's what I'm suggesting. I mean, even deep tissue massage. I mean, there's 1,000 ways that you can try to get these things to target.
Hmm. So essentially, creating that inflammation is what signals where they should go. You want to be loud enough to call them over, right? Like, hey, buddies.
Hey, buddies. Or what do you know about lymphatic massage? I don't know much about it, but I do know that if you were targeting alopecia areata in the head, these lymph nodes are where the inflammation's coming from. So I don't know.
It's so fascinating. I really appreciate you spending time with me. There's a lot of interest in what you're doing. You're obviously a pioneer in the space. And I remember when we first met, you had this glorious hair, but it looked grayer. And are you coloring that, or are you the beneficiary of your own
I will be
therapies?
honest with you. So depending on, look at Dr. Oz right now. His hair is starting to grow out black. And so depending on how healthy you are and how often you're using it, your hair is growing out black. And I've actually filed a preliminary patent for that. It's for graying hair, because I do have black hairs growing out of the middle of my forehead here after doing focused ultrasound and exosomes. In regards to my having to be a father of regenerative medicine, my hair is dyed right now because I had to go to a party on Saturday.
Thanks for the
But
honesty. I appreciate that.
I generally
You cheater.
let it look like yours. I mean, like, look at my beard. But
Uh-huh.
I swear to you, I make you this gentleman's bet that knowing what I know now and the dosage of exosomes,
Uh-huh.
the next time you see me at an A4M, maybe not this year, year after that, it is going to legitimately be black. And I suggest you keep asking
Wow.
me so
Okay.
that I can tell you when that singularity happens.
That sounds exciting. That sounds exciting. I have one more question. It seems like as we've had patients cycle through and get exosome IVs or injections, everybody has a I guess what I would describe as a very personalized experience of the benefit. Like one guy said he walked outside and he was able to see a tree that always looks fuzzy to him. That's about 100 yards away. What I experienced is, and maybe you can provide some explanation as to why, and or maybe not. Maybe I'm just that special. My mother would say so. That when I sat down in the IV chair, and within, I don't know, 10 seconds, a little bit of background. I have very low HRV. Went through a divorce a decade ago. Have not been able to figure my way out of it. Meditate all the time. Eat really well. Sleep a lot. Do everything that we know of to enable it, but unsuccessfully. I sat down in that chair. Within seconds, I started to giggle like a little boy. And then my HRV was 2 or 3 times the daily HRV score that I typically get. Do you have any theories as to what that is?
Well, I mean, I can't. We do our IV therapies overseas, by the way. We do them in the Bahamas and Roatan. But what I do see is the epigenetic changes, and this is what we're studying for the X Prize. This is a major portion of it. Is we've always seen, and and after seeing these methylation changes, I needed to know why. So looking at the mass spec of the protein profile, I could see histone acetyltransferases and deacetyltransferases, which are changing methylation patterns of DNA. When you do that, cells start to work normally again. It's the same reason that you use decitabine in some leukemias. You're randomly demethylating, hoping the genes that have been closed open back up. So when that happens, you start to express normal levels of proteins, albeit from testosterone to whatever else. And that's going to go away over time. So in a year's period, that will have gone away. But for a period of time, it's open. And so even this focused ultrasound that I told you about, where my hair started growing back black, I did that a year. I did it not this last July, but a year before that. And I started to feel like Superman 3 to 6 months after that. Then about a year, I'm starting to feel lethargic again, and my ability to play tennis like a pro came back, and then it went away again. And so that's why I knocked on Dr. Jordan's door. Hey, it's time. It's time to juice me up again. Let's go, because it makes you sad. It makes you very sad to know that you can be performing like this and feeling like this, and it's gone. And so I got treated again the other day, and just the next day I was on top of the world. So, it's something that I need for my life here going forward. And it can be on the period of, I mean, it depends on what's wrong with you, but I'm saying for normal longevity, it could be 6 to a year. Whereas if you have a really bad issue, it's gonna have to be more often to start off. Yeah.
Well, thank you so much, Dr. Ross. It's been great hanging out with you. Thanks for shedding light on the cutting edge science of exosomes and the work that you're doing at Chimera. It's just absolutely fascinating. It's exciting to be in regenerative medicine. And I know our audience will walk away with a lot more clarity about what's real and what's possible, maybe what's next. If our listeners want to learn more about you and Chimera, where can they find you?
Well, exosomes.com, real easy thing to remember.
Oh, that's a good one. Wow.
Yeah,
You were early.
that's what happens when you're first, right?
Yeah. Yeah.
That's where
Yeah.
we are.
Okay.
And like I said, we do these roundtables and such, and I appreciate you for having me on here because it allows me to clarify some things.
Yeah.
Um,
That's
yeah,
great.
anytime you want.
Okay.
And I hope to
So
get
if
down
you,
to Newport next time.
yes, please be our guest, get some of our beautiful sunshine without the hot rain and humidity like you get in Miami. Thank you so much. I really appreciate it. You guys are doing amazing things, and we're really happy and honored to be a part of your ecosystem. So for our listeners, if you like today's topic, don't forget to like and subscribe, and please leave us a comment wherever you listen to podcasts. And if you'd like to learn more about Stark, you can visit us at stark.health. That's stark.health.